Hi, my name is Phil. I'd like to talk about politics. In this video, I'd like to discuss Boris Johnson's decision to refuse help offered by the EU to obtain the medical equipment that we need more easily, more cost effectively. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So, the EU, as part of their procurement scheme, have been putting in orders for massive amounts of PPE, personal protective equipment, and other necessary medical equipment, including the much vaunted ventilators. Even during a crisis like this, the rule of economics hold, and larger customers can obtain what they want more quickly with a nice, tasty discount. This scheme is a very efficient and cost-effective way for member states of the EU to obtain what they need to help out their healthcare systems and staff. As the UK is still in the transition period, the EU invited the UK to join this scheme and get the benefits of membership, while we still anyway do. But Boris Johnson has refused. Now, when responding to the questions as to why you did that, and I didn't see this live, I imagine the question was posed, "Are you stark raving mad? Why have you done that, Prime Minister?" At least I hope it was. There was none of the usual rubbish about us being able to get better deals alone. No, that's gone because we know that's rubbish. There was no suggestion that there were any benefits to not joining this scheme at all, as they're, of course, demonstrably false. Boris Johnson just said, we're no longer members of the EU. That's it. That was it. He's not saying that there's a better way for us to get the equipment, because there isn't. He's not saying that there's a cheaper way for us to get the equipment. Again, there clearly isn't. He's made the decision, not based on any practical reasons, even if they happen to be lies, but ideological ones. He has yet again denied our health service the timely access to the equipment that it needs for no other reason than it fits his Brexit ideology, or that of his supporters. Take your pick. Now, as a result, we are going to have to wait longer for the equipment that, frankly, should have been ordered 2 months ago and still hasn't now. Although Dyson says that it's making 10,000 ventilators for the NHS, something I've sort of already talked about in another video, it turns out that the government are denying that this is the case. So the government itself is saying, no, we haven't put any orders in, as if that's supposed to be a good thing. In fact, I'm actually going to be hoping that that is the lie, because if they have still not even ordered equipment, even from something that's untested and that takes time to produce and ship, then we're going to be rapidly heading towards the infection peak. And if we're talking about purchasing ventilators that are going to be a different model to the staff that would need to operate them are used to, it's going to need to be a little bit of a training need there, I would have thought as well. That's just adding more delay. I mean, we are rapidly heading, so we're told, towards the infection peak. And at the moment, as far as I can tell from what suppliers are saying and from what now the government is saying, we haven't even put orders in for stuff yet. That to me seems beyond reckless. And for what? What's the reason for this? So that those of us who are on the pro-EU side are able to point and go, oh, look at the help we're getting from the EU. Brexit doesn't seem so clever now, does it? Well, we get to do that anyway. We're still pointing at the fact that the EU have a much better scheme for getting this equipment and we were invited to join it. The point is proven that being part of the EU is better than going it alone already. The only difference here is that there are more people going to have to die for the sake of this Brexit puritanical insanity. It also means that whenever the Prime Minister says that his government is doing all they can for the NHS, whenever he's asked, when are we going to be getting these things, Prime Minister? When is the NHS going to get these things? And he's just saying, we're doing all we can. It's a lie. It is a lie, because he's not doing all he can. Taking part in this bulk buying scheme of medical equipment would have been part of doing everything. He's not doing it, and therefore, for all his talk of stepping up testing and getting in more medical equipment, until it actually happens, then it's all lies. I don't need people telling me, oh, the government announced this. Yeah, they announced it. They've announced it 2 weeks ago, some stuff that still hasn't happened now. And this is an emergency. We don't get to say, oh, it takes weeks for this to happen. No, we need it now. You know, how many days in a row does a government get to say, oh yeah, we're doing this, we're stepping this up, we're doing this, without it actually happening? before you have to come to the conclusion that Boris Johnson is just all mouth and trousers. The opposite of the sort of leader that this country needs right now. And then another terrible thought struck me. If he did actually do all he could, let's say he actually did everything he could, that would mean spending money on a load of medical equipment, very little of which would probably end up in the hands of Tory donors despite his best efforts. And it would do that in order to save lives. Now, although Johnson has started implementing some sensible measures with varying degrees of success, scratch any notion that it is motivated by concern for our wealth. What he is seeking to avoid is the NHS completely melting down. We already know that he's okay with lots of people dying. He just doesn't want the NHS to actually have to stop in some way. If the images of patients laying in hospital corridors didn't do his image any harm last year, what about images of people laid out outside the hospitals itself? When more and more hospitals have to declare that they have no critical care capacity, what then? We're already in a situation where if a hospital declares that it has no capacity, the patient has to be transferred to a different hospital. Now, the extra travel time could actually kill a patient off that's having a heart attack, something like that, for example. What if clusters of hospitals no longer have critical care? What if it's an extra 100 miles to get to a hospital that does? What if 60% of hospitals end up without any critical care capacity? That would be politically catastrophic for him. So what he wants to do is he wants to make sure that the number of cases is below the NHS's capacity to deal with them. He needs it to be below, because if it's above, that's when the NHS melts. He needs it to be below. But he doesn't want it to be so far below that the NHS more easily copes, because the problem with that is that must mean he's spending more money on the NHS than he really wants to. And when you look at his actions through that lens, it actually sort of fits. He's doing just enough, or at least what he thinks is enough, which is not necessarily the same thing, to relieve pressure on the NHS. So instead of just opening the pressure valve to release the pressure, he's just fine-tuning it, listening in a little bit. Just let's make sure the whole gubbins doesn't explode, but we still need it to be under a great deal of pressure. And that's not doing everything you can for the NHS. And if that's true, if that is actually the way he's approaching it, that is an appalling way to lead a nation. And even if it's not really the goal, if that's not really the motivation, because that's my supposition, what justification could there possibly be for deliberately not actually doing everything you can to supply a healthcare system which was already buckling before this crisis even came along? So there we are. I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.